do is to communicate with the public and the press regularly and in a transparent, timely, and responsible manner, and we are continuing to do that. The first two Illinois cases that we had confirmed in January were successfully contained, and both patients have fully recovered and returned home. And you are aware of the third and fourth cases from my announcements over the weekend and on Monday. Today, we are announcing a fifth COVID-19 case here in Illinois. Our investigations are ongoing, but here's what we know so far. The patient is an individual in his 20s who acquired the infection during recent travels to Italy. He is currently in isolation at Rush University Medical Center and is in stable condition. My administration continues to coordinate with the Cook County Department of Public Health COO, Dr. Terry Mason, to identify all of the patient's close contacts. Additionally, I want to provide an update on the third and fourth cases. As I told you on Monday, we determined at our state laboratory a positive test for the fourth individual, the spouse of the third individual who tested positive at our state lab over the weekend. Both are in their 70s, both remain in good condition and are in isolation at their home. The CDC has now confirmed our state test that the third individual tested positive for COVID-19. He was recently traveling, including a visit to a state with community transmission. At this time, health officials can't confirm whether the third individual picked up COVID-19 during his travels in that state or here in Illinois. Given the uncertainty, we have to consider the possibility that this could have been a case of community transmission, but that is as yet unconfirmed. As Dr. Ezike has testified, community transmission is possible and has happened in other states around the nation. In this case, and in every possible case, our federal, state, county, and hospital level public health officials have worked to actively identify any individuals who came in contact with the patient. The risk to the general public remains low, but we are not taking any chances and preparing for all eventualities. Rest assured that we are fully coordinating across the state and local governments to prepare if there is any further spread. Given this virus's intensified influence on the elderly, we are paying urgent attention to our nursing homes, our veterans' homes, and long-term care facilities, as well as to the employees who serve those vulnerable populations. Yesterday, my administration distributed guidelines on best practices to prevent the spread of respiratory germs in these facilities. We've also equipped these facilities with emergency preparedness plan guidelines and agency contact information for their healthcare personnel. Since the earliest days of my administration, our agency directors have been coordinating preparedness throughout the state for any and all emergency situations, including enhancing our state's influenza plan. IEMA and IDPH work hand in hand to ensure the safety of our residents, implementing regular tabletop exercises, revising our emergency plans as needed, monitoring emerging threats, and coordinating appropriately with local, county, and federal partners. I want to emphasize the strength of our public health system here in Illinois. Our state and local health and emergency management agencies' personnel have decades of experience in developing responses and preventative measures for outbreaks. We were the first state in the nation able to test for COVID-19 because we knew to press for that capability. And we now have 3 testing labs in Chicago, in Springfield, and in Carbondale, all with the capability to run tests. Few states in the nation have our capability. Additionally, following the recommendation of the CDC and in lockstep with a few other large population states, we have launched voluntary surveillance testing at 7 hospitals in Cook County, 2 hospitals in other areas of northern Illinois, 1 hospital in southern Illinois, and 1 hospital in central Illinois to monitor for the presence of the virus in our communities. IDPH is in the process of confirming additional surveillance at hospitals statewide. I want to be clear. The best thing that the general public can do at this time is to take extra care and be vigilant about precautions that you should take during flu season. Take extra care to wash your hands. Stay home if you are sick. Cover your mouth and nose during any coughs or sneezes, and clean often touched objects and surfaces frequently. And call a healthcare provider to plan a visit to the doctor if you're experiencing any symptoms, particularly if you or a loved one recently traveled abroad. But please, let's be clear in our communications, in our conversations, that this virus isn't specific to any one ethnicity, nationality, or population. Nothing fuels hate or hysteria faster than fear-induced xenophobia. Finally, I want to reiterate my previous announcements about resources available to the public. Our Illinois Department of Public Health has a statewide COVID-19 coronavirus hotline and website to answer any questions from the public or to report a suspected case. That phone number is 1-800-889-3931 and online idph.illinois.gov. The Illinois Department of Insurance has communicated to insurance companies that we are on alert for any price gouging or unfair coverage practices, and we have reminded them of their obligations under the law in terms of coverage of insured and underinsured patients. And I've personally had conversations directly with the CEOs of the largest insurance companies in the state of Illinois, reiterating this, as well as our commitment to accessible and affordable testing and care. We're increasing staffing at our Office of Consumer Health Insurance, our toll-free hotline there, to ensure Illinoisans know their rights, whether fully insured, uninsured, or underinsured. And that hotline can also help individuals determine the full extent of their insurance coverage. The insurance hotline number is 877-527-9431. And on that note, my administration is closely monitoring the affordability of over-the-counter goods and services necessary for Illinoisans to be healthy. So let me say this loud and clear. Any price gouging will not be tolerated. Now, to provide a further medical update, IDPH Director Dr. Ezike.
Thank you, Governor Pritzker, and thank you to all of you for covering this important situation. As the governor mentioned, we do now have a 5th person here in Illinois, a man in his 20s, who has tested positive at our state lab. We call this a presumptive positive pending the final confirmation at the CDC. But meanwhile, as we trust our test results, the public health officials here in Illinois are quickly taking action, and the person is in the hospital. He was infected while in Italy, and all close contacts since his return to Illinois are being identified and being contacted. As mentioned, we have received confirmation from the CDC for the 3rd individual who we recently identified and called a presumptive positive. That individual and the spouse are in home isolation and are doing well. Because the 3rd individual did not have international travel or close contact with someone known to have COVID-19, it is likely that they acquired the infection in the community, although it is not clear which community, whether in our state or another state to which he traveled. Because the virus has been spreading in some communities in the U.S., Community spread here in Illinois is expected. However, at this time, we are not seeing widespread transmission of this virus in the general public, so we can still say that the risk to the general public in Illinois is low. Public health officials are taking measures to contain the virus among those who have tested positive, but we're also preparing for the virus to circulate in the community. We're working with hospitals to assess bed capacity and inventory the amount of protective gear that we have on hand. We're also partnering, as the governor mentioned, with hospitals in the Chicagoland area and throughout the rest of Illinois to conduct surveillance testing. Again, surveillance testing is a voluntary program for people who test negative for influenza, and those participating hospitals will be sending those samples to one of our 3 state labs that have this capability. This surveillance will help us to determine if the virus is circulating in the community and to what extent. With that information, we can tailor our response and better protect the health of all of our citizens. Again, this continues to be a rapidly evolving situation, and every day we're getting more information. Following our governor's lead, we will continue to be transparent and communicate often. We will make sure that we update you as soon as we have additional details. The number, again, for our hotline is 1-800-889-3931. You can also reach us by email at dph.sick@illinois.gov. Thank you. And now I will turn it over. Okay.
Thank you. I just want to make sure everybody knows. So first of all, thank you to Dr. Ezike. She is putting in long hours, terrific work, she and her staff, the entire Department of Public Health. Now to talk more about the significant statewide preparations that we've been working on for not just weeks, but for months, and in some cases, years. IEMA Director General Tate Nadeau.
Thank you, sir. Illinois Emergency Management has been taking aggressive and proactive steps to address this evolving situation. Yesterday, we met with 56 state agencies and mutual aid partners to discuss our current plans regarding the coronavirus in Illinois and reiterated the governor's direction that the full weight of this administration is available to protect the health, safety, and welfare of Illinois residents. In addition, we began working with over 127 counties and emergency management agencies and accredited jurisdictions who are working hand in hand with their local public health departments to address community readiness. Local emergency managers are currently updating and preparing to implement their continuity plans. The goal of the continuity plan is to ensure the entities are able to provide essential functions during an all-hazard emergency or a disaster. This practice requires you to ask tough questions and find the tough solutions to the scenarios put forth. If for any reason additional resources are needed by our counties or jurisdictions to accomplish this at the local level, IEMA stands ready to provide direct guidance and assistance. We are also reaching out to the private sector partners to ensure that they have information and guidance that they need to execute their own continuity of operations plans. I want to remind the public that to make educated decisions about upcoming travel. As a reminder, the CDC updates travel advisories on its website as it relates to the coronavirus. Right now, the CDC recommends that we avoid all non-essential travel to China, Iran, South Korea, and Italy. Meanwhile, those with chronic medical conditions should consider postponing travel to Japan. It is with this in mind that we are working with our federal partners to monitor people coming in from other countries. Right now, there is only guidance as it relates to flights from China and Iran, but we do know that Italy and South Korea are doing monitoring at their side before they ever leave the country. But we will continue to work with our federal partners as the situation develops. Again, health emergencies are not new to Illinois or to the nation. We train year-round to address new and emerging threats, but I want to remind the public that you too play a part in this effort to control the spread of this virus. Cover your cough, wash your hands frequently, and don't go to school or work if you are ill. And make educated decisions about attending or hosting large gatherings. Make decisions based on facts, not based on fear. This is a common sense health guidance that we have been utilizing for years, and we should not stop now. At this time, I invite Governor and Dr. Ezike for any questions that you might have.
Dr. Ezike, if I understood correctly, one of the problems in Washington that hampered their effort getting ahead of the thing was the delay in getting test results back. If that's correct, how important is that, and how important is it to have additional labs here to test? You know, will that help stop the thing?
Absolutely. So as the first state in the country to be able to test on site, we were able to circumvent some of those delays with our subsequent cases. So all of our samples are sent from area hospitals to one of our public health labs, and so we can run it on site. It's just the confirmatory tests that are sent to the CDC for us, but we know that we can act once we get our positive result.
But you're treating the symptoms already, right? I mean,
Right. We don't wait.
What does it mean to have that confirmation? Just that, in terms of...
Yeah. It's just per protocol. They said that the final confirmation would be at CDC, but we don't wait for that. As soon as we get a positive result, we act on that because we know that's going to be a confirmed.
What symptoms should people be looking for in all of this? It's one of the biggest questions we get is, what are the actual symptoms? People confuse the flu for digestion issues, but this is, what are the
Yeah, so it is similar to some flu-like symptoms. It's fever, it's cough. People can have a pneumonia actually on the chest x-ray, so difficulty breathing, shortness of breath. So it's usually what we call lower respiratory symptoms. So any of those symptoms, again, those are kind of vague. It looks just like your influenza-like illness, maybe completely. It's impossible to definitively diagnose what it is just on the surface, but having those symptoms and then having the additional risk factor of being in a high-risk area or connected to someone, obviously you would want to let your provider know that information so that the level of suspicion would be appropriately higher.
This is a 20-year-old that got this, the most recent case. The other cases were in their 70s. You could talk a bit about how it's not necessarily older people who are getting this, and maybe if you could tell us about the severity of the 20-year-old's case. Is he
Okay, so in general, and what we've learned from abroad, especially in China where the majority of cases have been, the fatalities have definitely been concentrated in older, more infirmed people, i.e. they had pre-existing medical conditions which predispose them to more complications. Of our 5 cases, 4 of them were 60 and above, 2 in their 60s, 2 in their 70s, and then now we have someone in their 20s. We are monitoring that patient currently in the hospital, and we'll have more details as that unfolds.
Doctor, can I ask you something? One of the criticisms people have pointed out that tens of thousands die every year from the flu, and that by us all covering this, we're making too much of it and blowing it out of proportion. And Governor pointed at it. We just had Oracle cancel coming to McCormick Place. I don't know what your thoughts are on the impact. And again, it kind of ties in together. Are we causing problems by all this coverage? And the impact on the hospitality industry by, who knows how many people won't be coming to places like Chicago for their conferences because maybe we're guilty of overcovering this.
Well, look, this is new. This is new. So I think anything that is new causes heightened concerns. And I would just say that we're relying upon the CDC, we're relying upon medical experts, and our observations about the spread of COVID-19 across the globe in order to make decisions about how we ought to react. I think it's hard to tell whether this is something that will crest sometime soon for the globe or here in the United States. And I think as a result, we are taking significant precautions. We're preparing. We've been prepared, but we're making heightened preparedness the focus of the work at IEMA and at IDPH. And as the director of IEMA said, we are talking to every single one of the counties and their health authorities and officials, every major city in the state, to make sure that we're coordinating all of the responsiveness just to be prepared.
Your Honor, why, it seems like an extraordinary step to pull all the lawmakers together to do a briefing with them as well.
Well, I think in part, in the answer to the prior question, too, because of all the coverage and because of the unknowns, I think it's very important for elected officials, people who represent our state, to know all of the facts. I think many people have gotten lots of information from us, but not all in one meeting. And so we wanted to make sure that we brought all of the latest information as we are today to you, to them, and to answer any questions that they may have. You know, that we're representing rural areas, ex-urban, suburban, and urban areas all across the state. And there are just, you know, questions that people don't have answers to. So we wanted to make sure that all of our leading officials are available to answer those questions.
A message to employers. We keep hearing, stay home if you're sick. You're all about lower income people, people making a living wage and providing for the families. A lot of those people don't have sick time.
Yeah.
Should they stay home and get docked?
Look, what I can tell you is that if you're sick, you should stay home. I think that I have talked to employers and I've tried to communicate more broadly that employers should be understanding of this situation. It would be great if people have sick time and they are sick and they need to stay home. This is the moment in which to take that sick time. But I don't disagree with you that it would be a hardship for people who are, particularly those who are earning minimum wage or lower income people, when they get sick, but you've got to watch out for your health. Now, we have health coverage. We're making sure that Medicaid and other insurance coverage is doing what it needs to do to address people's illnesses as they arise. But fortunately, we've had 5 cases, several of them confirmed by the CDC, but again, 5 cases that our labs have confirmed in a population of 12.7 million people.
How long does it take for
Hannah.
results to get back from state labs, and then also how long is it taking to get back from the CDC?
Yep, I'll let Dr. Ezike answer.
So if we get the specimens in our lab in the morning, we will have the results the same day. Then we will ship it out to CDC, and we don't have control over that timeline. For our first 2 cases, when we didn't have the capacity, the turnaround time was up to a week. But again, once we get our positive lab, we're acting on those results.
And let me add, I think, would you confirm, it takes about 5 hours, that's what I've been told, between the time that specimens are delivered and the time that a result from the test is done. And again, we're not waiting for the CDC. Remember, each time specimens are taken from an individual, they take 3 specimens from the same individual. And then those 3 specimens are the ones that are being tested at our labs in order to confirm at the state level that we think somebody has COVID-19. Then comes the federal government, the CDC's confirmation. Peter?
To start discouraging or canceling large public gatherings, sporting events, the state fair, if it's going on.
Yeah. We're not in that situation today. Again, the risk to the general public remains low. We've contained the 5 cases that we are aware of, but we're monitoring very closely. We're going to keep people informed. We're not going to delay to let you know, and that's why you've seen us out here virtually every other day.
Have you had any contact with the administration relative to airlines and the impact of people coming into, are they going to be, I don't know if there's been anything said about airline travel and obviously the impact on places like O'Hare.
Well, there's been monitoring. I want to hand it over to General Tate Nadeau, but there's been monitoring at the airports as people are entering, particularly on international flights, from areas that are level 2 or level 3 countries. But I'd like to turn it over to General Tate Nadeau.
Yeah, great question. So there are 3 levels of screening that occurs at O'Hare right now. Once that has occurred right now, that is for China and Iran. So the question is, there are 2 countries that are doing screening before people ever leave. That is South Korea and Italy. So we are working, matter of fact, right before this, we had a phone call with the federal government just to talk about what the guidelines are related to people coming into O'Hare and how we'll continue to monitor those.
Do you know how many people coming, would have been on the flight from the individual coming back from Italy, how widespread his contact may have been?
I'll turn that one over to Dr. Ezike.
So as part of our contact tracing and investigation, we have identified the flight. Per CDC guidelines, we will be contacting the requisite people, and that usually involves maybe 2 rows in front and then 2 rows to the side. So those people will be contacted and be notified and be monitored for 14 days from their contact to make sure that they don't develop symptoms. So that's underway.
This fifth individual is in their 20s. Many colleges are pulling students from their study abroad programs right now. Parents are curious, are they okay even if they're not showing symptoms right away? Any thoughts on that? What students and parents should look for?
Great. So we are recommending, and as well as the CDC, that anyone coming back from Italy, coming back from a study abroad or whatever program that took them over there, that when they come home, if they don't have any fever and respiratory symptoms, that they do home isolate for 14 days. And if they develop anything within that period, to contact the health department so that we can arrange for testing.
Governor, how
Guys,
many
we have time
hands
for
a day
two more.
do you shake? This is a question. How many hands a day do you shake? And are you still shaking hands? And how are you keeping healthy?
Yep, thank you for asking. As you can imagine, when you're a public official, and I think that we would hear this from the members of the General Assembly, people put their hand out all the time. We put our hands out all the time. Typically, I would say, I hope some of the cameras caught that. I would say that it's important for people just to take extra precaution now, particularly people who are in the business of greeting the public, that it's okay to, elbow bump somebody or just to say, hey, great to see you, and not shake hands. We want to make sure that we're all being careful about this. I, of course, wash my hands at a regular basis, and, to the extent that hand sanitizer is available. I use it whenever I see it, and I encourage others. And then, wiping down surfaces that you're commonly using, that other people are also commonly using.
How at risk are some treated
If somebody goes to this more for Dr. Ezike.
Yeah.
Somebody shows up at Memorial Hospital, they have some symptoms, but they haven't been abroad. Are they tested? Is there rationing of tests going on now? And what that gets at is, are you confident that there's enough testing to detect the community spread?
Yeah, that's a great question. So I was in D.C. yesterday, and one of my requests is that we need to have more reagents available so that we can do broad, widespread testing. That would be the goal, and that would give us the best information in terms of what is circulating in the community. At this point, given that we don't have unlimited supplies of reagent, there is some kind of triaging that's going on. And so we do put people high on the list, obviously, who have traveled from one of the hotbed areas, if you will, but there is also a provision for people who are extremely ill for which we could not find an alternative diagnosis. And so we are working with the clinicians and the health departments to see if that case warrants to be added to the coronavirus testing. Thank you.
Somebody who hasn't asked a question, maybe.
By chance, really quick, I'm seeking a reaction. Republican congressman say you sent a letter to the president about the national security advisor situation, possible attempts of Russia hacking, and previous attempts in 2016. They say that you got some facts wrong there, but they're also saying that you need to focus on Illinois and the ADR problems that are happening. Can you address that?
Well, they would like me not to focus on the fact that the president fired his DNI for telling the truth to Congress. These are Republican congressmen that are speaking. What I've written a letter to the president about is to make sure that I get fully briefed on any kind of potential Russian hacking or interference with our elections. I've been focused on this since before I took office. And the day one in office, I gathered people in my administration who are in charge of securing our elections to make sure we're doing everything we can. But we need to get proper information from the intelligence community, from the federal government, and it appears when the president is firing his DNI for telling the truth about Russian interference, that we're not getting all of the information we need. So I insisted that we get that. Thank you.
Governor just endorsed Joe Biden. Are we going to hear an endorsement for him anytime soon?
Democrat, 2020.
Who's Democrat? Is he on the ballot?
Whichever one we get.
She indicates she wishes to proceed. Mr. Secretary, please read the bill.
Senate Bill 3418, an act concerning criminal law. Second reading of the bill. No committee or floor amendments reported.
Third reading. Next, we're going to skip to Senate Bill 3426. Senator Bush has Senate Bill 3426. She indicates she wishes to proceed. Mr. Secretary, read the bill.
Senate Bill 3426, an act concerning civil law. Second reading of the bill. No committee or floor amendments reported.
Third reading. With leave of the body, we'll skip down a couple bills till Senate Bill 3452. Senator Weaver on Senate Bill 3452. He indicates he